11 के बाद वो एक्सेप्ट ही नहीं करेगा, फिर आपके बोलना नहीं कि मेरा आ जाना।
ओके, मी चेकआउट करतो सर. ओके. नाही, मी मॅडमला सांगतो करायला. एक मिनिट, माझं लॉगिन करतोय. मॅडम, त्यांनी तुम्हाला लंच केलेला पीपीटीचा तो आहे तुमच्याकडे.
हेलो ओमकार, तूने जो कल रात को तूने किया है क्या 2 मिनट?
ठीक है, मैं देख.
ठीक है, एक हाँ हाँ होगा होगा, ठीक है 2 मिनट दे मेरे को, ठीक, जीमेल बताओ.
हो.
आई एम जस्ट कीपिंग ऑन लाउड स्पीकर. अच्छा डस्टर इधर है. आपको इंटरनेट बनवाएंगे,
आपलं नेट.
ठीक है ना?
हो. ओके.
मैंने हे आपलंच लोक.
नाही, आपल्याला होस्ट आहे ना आपण, मग मी चालू केले मटेरियल. त्यांना सांगितलं होतं meeting साठी.
इस फल के लिए चेयर बैठ सकते हैं. नो डाउनलोड होना.
हेलो हेलो.
हाँ होत नाही यार, बराच
या फिल्म
हो रहा है, स्लोली हो रहा है. मे बी आई हैव क्लिक ट्वाइस.
इन्होंने क्यों ये
अरे मी 2-3 मिनिट डाउनलोड केलं. ओह माय गॉड.
स्पीड वाढवत
ते आणि कर ना, ते लॉग आउट कर. झालंय मी 3 वेळा त्याला दाबला.
ठीक आहे, ठीक आहे.
एवढं इरिटेशन झालेलं की आणि काय मिळत बॅलन्स मोबाईल
इकडे तिकडे.
नाही हा नाही. अच्छा ठीक आहे. तर हे चालू करा, इथनं प्ले करा ना आपण. हा त्याला फोन करून सांगू चालू करतोय आपण म्हणून. मीटिंग
जॉईन झाले ते का फक्त बघू त्यांचे.
आणि सरांना इंट्रोड्यूस करायला थांबते. तर एकदा चालू झालं का सगळं
त्यांना म्हणून जॉईन करा मीटिंगला.
कसं लागला पण ह्याला
Somebody is still more impatient to decide feel better.
Hello. We are starting and if we start, sir will introduce you and then
Login.
हॅलो.
लॉग इन करायचं.
नहीं स्क्रीन शेयर मत करना, वी आर डूइंग इट फ्रॉम हियर. ठीक है. वो जो पहले भेजा था ना लिंक बड़ा वाला वो एक मिनिट रुक जा यार. ते बाई त्याच्याशी बोल. हॅलो, आवाज येतोय की नाही कळेल ना आपल्याला.
आता लिंकला कनेक्ट केल्याशिवाय कळणार.
करा की लिंक जी आहे ना त्याच्यावर तुमचा आवाज नंतर
कनेक्ट झालं.
हा, आवाज येतोय माझा?
एक मिनिट जॉईन केली.
हा येस. आता म्हणून बोलावं.
हा, आता आवाज येतोय का माझा व्यवस्थित? मी फोन कट करतो, थांबा. हा, आता येतोय माझा आवाज व्यवस्थित?
हॅलो सर.
हा, आता येतोय का आवाज व्यवस्थित? हॅलो हॅलो हॅलो.
व्हिडिओ लावूच नका म्हणून.
व्हिडिओ लावू नको.
व्हिडिओ लावूच नका आणि नुसतं माईक वर हे कर.
नेक्स्ट पण म्हणा, विल जस्ट
व्हिडिओ बंद करू का?
तुमचं फक्त व्हिडिओ बंद करा आणि माईक चालू करा. ऑडिओ
बर, आता 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 आवाज येतोय का बघा. आता आवाज येतोय का? आता आवाज येतोय का? आता आवाज येतोय का माझा? आता हॅलो, आता आवाज येतोय का माझा?
नाही.
आता येत नाही. व्हिडिओ बंद केलाय मी. हॅलो, आता येत नाही. मोबाईल वर अजून प्रॉब्लेम आहे. मेघना, आवाज येतोय का नाही येते माझा? तुमचा आवाज मला व्यवस्थित येतोय, माझा तुम्हाला काय येत नाही, काही कळत नाहीये. पण बँडविड्थ तर चांगली आहे. काय करायचं? दुसरा ऑप्शन काय?
त्यांनी हे केलं होतं इंटरनेट कॉल विचारवलं.
एक मिनिट.
इंटरनेट कॉल सेटिंग करायला.
कुठलं काय करू म्हणतात? सेटिंग सांगा मला.
माईक त्यांचं चालू आहे.
ऑडिओ व्हिडिओ
माईक अनम्यूट करा.
हा, आता येतोय आवाज? हॅलो,
नाही.
अनम्यूट केलं तुम्ही तरी पण नाही येते. म्युझिक अनम्यूट टेम्पररी बाय होल्डिंग स्पेस बार. हॅलो, आता येतोय आवाज? नाहीच. स्पीकर मायक्रोफोन सेटिंग मध्ये गेलो मी. मायक्रोफोन
तिकडे आवाजच येत नाही. आता बोला.
हा, आता येतंय ऐकू? हॅलो, येतंय ऐकू?
येतोय का?
हा, हॅलो. मेघना,
एक सेटिंग असते
इंटरनेट फॉर रेडिओ. असं म्हणते.
नाही 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 रे बाबा,
ते
ऐसा नाही
मोबाईल
करणार
असते.
मी. इतना भी आता येतोय का? आता बघ तिकडे माझा आवाज येतोय का बघ, मी
त्यांनी
बोलतोय.
लॅपटॉपवर लावलं.
हा
नाही.
नाही, मला तुमचं सगळ्यांचं व्यवस्थित ऐकू येतंय, पण माझ्याकडून तिकडे आवाजच जात नाहीये. आय एम ट्राईंग हेडफोन्स नाव. ओके, गिव्ह मी 1 सेकंड.
Maybe that will not catch it. त्यांना आपला सगळा आवाज जातोय हा. पण त्यांचा आवाज येत
हॅलो,
नाही.
आता येतोय का बघ बरं, मी हेडफोन लावून बोलतोय.
हॅलो गणेश सर.
हा बोला.
हा,
Just
कोणाचा आवाज आला होता? बोल.
आनंद
हा,
चालू.
माझा
बोल.
आवाज.
आता येतोय आवाज?
आनंद चालू.
नाही. नाही.
नाही ना, माझा आवाज नाही ना येते.
नाही.
अभी क्या करना, व्हॉट इज द ऑप्शन?
हा सर, आता येतोय. ओमकार सर.
मी फोन कट करून बोलतो, थांबा. मी
हा हा.
काय येतोय आवाज?
येस सर, येस सर.
मग मी फोन कट करतो, एकदा बोलतो, व्यवस्थित येतोय का मला सांगा. हॅलो,
मला येतोय नाही तसं.
इथलं आउटपुट.
हा आता येतोय का आवाज? मला व्हिडिओ हे आहे इथे. ते त्यांचं म्हणणं बँडविड्थचा प्रॉब्लेम आहे. ह्याला फोन लाव बरं, का भारी. मेघना, कॅन यू हिअर मी? हॅलो हॅलो, त्याचा आवाज मला आता अजिबातच येत नाही.
हे आपलं त्यांनी बोललेलं आहे यायला पाहिजे.
त्यांचा हातात नाही. आता मी पण बोललो तरी येतो ना तुम्हाला आवाज. म्हणजे आपल्या सिस्टीम मध्ये काही प्रॉब्लेम नाही ना. मी बी दुसऱ्या नेटवर्क वरून लॉग इन.
त्यांच्या इथं हे करायला पाहिजे ना, काहीतरी सेटिंग असणार.
त्यांच्या इथे नाही.
हॅलो.
हा हॅलो
आहे का?
हॅलो
हॅलो.
हा ओमकार सर.
हा बोला.
हॅलो.
हॅलो हॅलो हॅलो.
कम्प्युटर मग त्यांनी तसंच केलं ना.
स्पीड नेटवर स्पीड डॉट टेस्ट वर 90 मिळतं. हॅलो
हॅलो.
हा बोला.
ओमकार सर.
हा बोला ना.
येतोय आवाज. इथंच लो येतो. हॅलो.
हॅलो, मला तुमचा आवाज येतोय, पण माझा आवाज जातच नाही बहुतेक तुमच्याकडे. कॅन वी चेंज टू झूम और समथिंग?
हॅलो.
कॅन वी चेंज टू सम डिफरंट प्लॅटफॉर्म?
त्याला येत नाही.
हॅलो, ऐकू येतंय का?
गणेश, त्यांना आवाज
हॅलो.
बरोबर नाही.
जातोय. हो,
त्यांचा पण
त्यांचा थोडा येतोय आवाज, पण मोठा येत नाही. पण ह्याच्यावर येत नाही.
laptop
नाही सर, लॅपटॉप मध्ये प्रॉब्लेम असेल तर मी लॉग इन झालो. तुम्ही बी लॉग इन करा त्या लिंकला आणि चेक करा. हा सर.
शिवाजी सर बोलते, तुमचं सगळा आवाज येतोय आम्हाला ऍज अ ऑडियन्स म्हणून. सगळं जे डिस्कशन सुरू
हो.
आहे ना सर, ते
हा,
आम्हाला
पण सर
ऐकायला क्लिअर येते.
ओमकार सरांचा आवाज येत नाही.
तो पण येतोय बहुतेक, मला वाटतंय. एक मिनिट, त्यांना बोलायला सांगा, मग मी सांगतो तुम्हाला.
ओमकार सर जरा कम्युनिकेशन करा.
नाही ओमकार सरांचं येत नाही. तुमचा किम्स डीयू आयटी म्हणून आम्हाला क्लिअर सगळं ऐकायला येते. तुमचं जे काही संभाषण सुरू आहे ना,
हा.
आमचे स्टुडंट काय झालेत नर्सिंगचे, तर ते सगळं ऐकतायत.
ओके.
फक्त ओमकार सरांचा येत नाही सर आवाज, बघा.
तोच प्रॉब्लेम आहे सर. ओमकार सर मेन आहेत ना आवाज सर.
ठीक आहे. थोड्या वेळापूर्वी आला होता थोडा आवाज त्यात, आता पूर्ण बंद झाला.
हा, नेटवर्कचा इश्यू आहे का काय? येस येस.
त्यांनी बघून जॉईन केली.
चालतंय की त्यांना चालेल सांगा मोबाईलवरून जॉईन करा.
नाही तर मोबाईलवर बोलायला.
हॅलो मेघना,
हा सर
Yes,
आता
you're
येतोय आवाज.
audible.
मी लॅपटॉप बंद करतो आता,
हा चालेल.
मीटिंग बंद करतो.
थोडा वर.
हॅलो,
हा सर चालेल चालेल.
ठीक आहे. आता येतंय व्यवस्थित ऐकू?
हा
हा,
आता
येतोय.
आवाज व्यवस्थित येतो.
त्याचा आवाज
हा, आता काही अडचण नाही ना?
हा कमी करा.
ओके, आता व्हिडिओ चालू करू की नको करू?
काय आवश्यकता नाही आहे सर.
तुम्ही काय करू नका इथून सगळं.
नेक्स्ट बोलत जावा.
आम्ही तेवढं बोलतच नाही ना.
मी नेक्स्ट सांगेन माझं.
चालेल.
येस येस.
चालू.
करू द्या.
एकच मिनिट सर फक्त एकच मिनिट.
खालचा
फायनल ना.
फायनल. हा
प्रेझेंटेशन इज विजिबल.
येस.
सर
असू दे की दिस इज इनफ. हॅलो ओंकार, गुड मॉर्निंग.
मॉर्निंग सर.
हॅलो हॅलो.
हा सर, ऐकू येतोय माझं?
हो हो, सेम विथ मी. आर यू आय एम आय ऑडिबल टू यू?
येस सर. येस सर.
Okay, okay, okay. So with initial hassles, we'll start now, right?
नो
Okay,
प्रॉब्लेम.
okay. So I am doing my favorite job, that is welcome to our guest speaker. Today's guest speaker, it's always a dream for any teacher to be in the audience, to listen to his alumni on the stage. and what we call in English head high. So this is what the position I will take in the audience today. He happens to be our alumni, Dr. Omkar Joshi. He is going to be our speaker today. He is a leading psychiatrist in Shirdi. He did MBBS from KIMS, our university. It was Nashik University then. Then he completed his psychiatry post-graduation in prestigious GS Medical, that is KM Hospital, Mumbai. And then he started his practice at Shirdi. I think he passed from 2009 MBBS and completed his psychiatry post-graduation in KEM around 2013-14. And then he joined Nashik Hospital. At present, he runs his own big hospital in Shirdi. He's a leading psychiatrist. And his name of his clinic is Mana Arogya Kendra in Shirdi. Shirdi itself teaches you Shraddha, and Saburi is going to talk on emotions. He was working as a consultant psychiatrist in Nashik, first initially in District Hospital Nashik around 2013 to 15. Then he was also an honorary consultant in Suvichar Hospital and Shatabdi Hospital in Nashik. He has so many achievements at such a young age. He worked as a television show anchor with DD Sahyadri for 2 years along with this. So I need not say what communication skills he must be having. Then he conducts so many awareness programs of mental health and de-addiction in Shirdi and nearby places. Then in another mission, we had a talk. He said his teacher was Kedari madam from KEM. He picked up the idea of his teaching special educators, means teaching teachers for awareness, especially in this scenario of COVID. So he taken nearly 150-160 teachers training to make them going there and making awareness in their respective members in the society. It's a great job done by him. And also that was mainly on child psychology also. And he has got free psycho education for patients and their relatives regarding various mental illnesses and caregiver burdens. And he has another interest in stress management for doctors. You are budding up, we are so-called established doctors. So he is also one of the motivators in managing stress management for doctors. Of course, he has also had a skill on computers also. He has had his basic qualification in that also. So in the way, we are getting a very good speaker, a very young speaker, dynamic speaker. And now I hand over the mic or what is online speech to Dr. Omkar. Omkar, please.
Thank you very much, sir. Good morning, all of you. Am I audible?
Yes, sir.
Okay. Good morning, all of you. My respected teachers, Dr. Karambekar sir, all of my teachers from Krishna Medical College, my senior who taught me psychiatry, Dr. Meghna and Dr. Rajesh, whole psychiatry department of Krishna Medical College, and my dear friends. This is an emotional moment for me, actually. Sir said that I'm an alumni of Krishna Medical College. So yes, this is an emotional moment for me. When I was in third year, like you guys, Dr. Anand Narkar, esteemed psychiatrist from Mumbai, had visited our college. We used to have an annual day program that time. And he had talked about psychiatry, stress management, emotional regulation. And I got inspired by his talk. And after that, after completing my MBBS, I decided to pursue psychiatry. Fortunately, I was taught by Dr. Narkani sir. He became my mentor, and now the circle is getting completed. That I am talking in front of you with the same topic. So I'm really emotional today and really proud, feeling really proud. So when Dr. Karambekar sir called me and he asked me what topic you want to share with students, so I decided to talk about emotions because this is a very important topic, especially in COVID time, because we had so many issues around the 2 years and we managed it very well. So starting my presentation right now, next slide. So as you can see, next slide please. As you can see on the screen, these emojis called emotions or emojis every day. Right now also in the morning, someone most of you uh, on Twitter or Facebook, you have added your status, feeling happy, feeling sad, feeling joyful, or feeling anxious, anything. So we all add status every day. We all use emojis. We all use emotions every day. So emotions or emojis has become a way of communication every day. But what is emotion? Let's understand emotion today. Let's understand the effects of emotions and how to manage these emotions. Okay. So next slide. So the next slide. Next slide. So as you can see on the screen, this is called cognitive triangle. We all have, this is in our brain. We think first, we have thoughts, then we get feelings about the thought, and then our behavior changes accordingly. For example, I have a thought of studying. I feel motivated. I start studying. Okay. Or I have a thought of hitting someone. Uh, I have a thought of hating someone. Then I feel anger. Then I go and have a fight with that person. So thought, feeling, and behavior, all three affect each other. In our psychiatry, if any one of it, if thoughts are disturbed, or feelings are disturbed, or behaviors are disturbed, so any of it is impaired, we call it as a psychiatric disorder. Okay, so let's understand emotion. Next slide. What is emotion? Emotion is energy in motion. Emotion is a dynamic, kinetic experience. See, if I am angry, my tone will increase, my speech will increase, my body posture will change. So when there is an emotion, everything will change. Okay. So I can't be angry. Very, I'm angry. I want to scold you. I can't speak in this tone. If I'm angry, I will get out of my class. That is my tone. So, if whenever an emotion, whole body, whole your atmosphere experiences that. So, emotion is energy in motion. The original Latin word movere is to stir up. So जैसे अंदर से कुछ हो जाता है वैसे experience the emotion. Okay. So emotion is a kinetic process. It's a continuous process. So next slide, please. But as we are students, as medical students, we have a habit of classifying. So let's classify emotion. Can you tell what is the classification of emotion? It can be, we normally classify as a negative emotion or a positive emotion. We classify, we can classify as a helpful or harmful emotion. But today we are not going to classify it in a binary or white, black and white. We are going to classify in a different way. Okay. So next slide. So next slide, please. So today we are going to classify emotion in 4 parts. First is intolerable. There are 2 types. One is negative emotion, one is positive emotion. But negative emotions also we are going to classify. First is intolerable, negative emotion. Second is tolerable, but still negative emotion. Third is pleasurable emotion. It is a positive experience. You feel good about these emotions. And fourth one is still it is a positive emotion, but it's too pleasurable. I am going to give examples of all 4 of it. We'll understand with few examples. Okay. Next slide, please. So this is an example. You read it. I'm going to read it. Reva is an 18-year-old college student. She stays with her parents and younger brother. After this COVID unlock, her friends from college have planned a trip to Goa. So she asks permission to her mother. So with this talk, I'm going to speak with about Reva and mother, and you guys have to identify her emotion and classify it whether it's a pleasurable emotion or it's a negative emotion or it's a positive emotion or whether it's a tolerable or intolerable. You have to classify it. Okay. So Reva is speaking to her mother. Reva, my friends are going to Goa for a short trip. I want to go. No, beta, it's not safe. Why, mom? Why? You can't do this to me. All of my friends are going. But beta, COVID cases are still rising. Whole world is going out. Only I will be locked in this jail. You always do this to me. You permit everything to Bhaiya, that is my brother, and nothing to me. Don't ever talk to me. And she just slams the door and get out of her room. So can you identify the emotion of Reva? How Reva is feeling? So Reva is feeling very angry. She's frustrated. She's angry. So this is an intolerable emotion. This is negative emotion and an intolerable emotion. Okay. The second talk. Okay. Same situation. My friends are going to Goa for a short trip. I want to go. Mother says, no, beta, it's not safe. But all of my friends are going. I want to go. COVID cases are still rising, beta. I am worried about your health. Reva says, I don't like this. I will take all necessary precautions, mama. Mother says, I know, but it's still not 100% safe. And you are not vaccinated yet. Reva says, okay, but next time I will definitely plan a trip with my friends when COVID is over. Mother said, okay. So now situation is the same. Okay, but emotion is changed. Okay, the first scenario, it was anger. Now here, Reva is still not happy. She is little irritated. So her emotion is still negative, but it's tolerable emotion. She can tolerate it. She can stand it. She can have a good conversation with her mother. So the first one was very intolerable, negative. The second one was tolerable, but still negative. When we classify emotion as only negative or only positive, we have a habit that we don't want any negative emotions, but that is not the case. There are few negative emotion is harmful to us. Okay, so let's move on to a third scenario. Third scenario is next slide. Thank you. Arnab is an engineering student. He just finished his final exam, Viva. He's telling his friend Rahul about it. Identify this emotion, identify Arnab's emotion, and classify it. Okay. Rahul says, how was your exam? Arnab, it was good. I could answer most of the questions. Arey, you are the topper of the batch. You know everything. Arnab says, I studied hard. I studied really hard for the exams. And examiners also ask simple questions. So I'm happy that I could answer most of them. Rahul says, so I'm looking to a future university ranker right now. Anandam says, don't know, but I'm confident that I will get good marks. Okay. So as we can see, we can identify the Arnab's emotions are positive emotions, the emotions of confidence, emotions of happiness. So these are positive emotions. These are pleasurable emotions. So he's happy, he's confident, and even with the Arnab, Rahul is also happy and Rahul is also feeling good. Okay. Now the next situation, same situation. Rahul says, how was your exam? It was simple, piece of cake. Oh, I heard you answered most of the question. Most? I answered all the questions. Examiner की तो छुट्टी कर दी मैंने. Rahul says, so you will definitely pass. अबे pass क्या? Topper बोल topper. This year I am going to top all the subjects. Not only this year, next 3 years I am going to be king of this college. So can you identify the emotion of Arnav? Though it's a positive emotion, though it's a Arnab is feeling good about him, but it's more of a too positive or too pleasurable. It's kind of a you can say self-loathing. He's arrogant. He's arrogant pride. So this is overconfidence. So as Arnab is going through this emotion, Rahul is not feeling pleasurable. Rahul must be feeling क्या बात कर रहा है यार, कितना कितना डिंग मारता है. So though this is a positive emotion, this is this is a pleasure, though this is a pleasurable emotion, but still it's not good or it's not helpful emotion. So we have seen 4 types of emotion. I will shift to next slide, please. So let's again understand. There are 4 types of emotion. One is intolerable negative emotions. The examples are anger, depression, anxiety, guilt, or self-blame. Okay, if someone is angry, the thought is to punish someone or take a revenge. If someone is in depression, the thought is I have lost everything. It's not worth trying. I can't do anymore. If someone is anxious, that there is a lot of fear that I can't handle this situation. I will be not happy. Uh, I'm not worthy of love or affection. So I'm anxious. Or if someone is guilty or someone is having self blame, then the thoughts are I have lost this because of my faults. I have to blame myself for everything. Okay, so these are negative emotions and these are intolerable emotions. There are still negative emotions, but still we can tolerate them. We can go ahead with these emotions. Those emotions are irritation, sadness, concern, and regret. You will ask me why what is the difference between anger and irritation? If a person is angry, his choices are very limited. Anger, depression, anxiety, these are called choice blocking emotions. We can't think properly. We can't formulate a new plan in this situation when we are on intolerable negative emotions. The same happens with the pleasurable, too pleasurable and positive. Look at the right hand side of this table. There are emotions like overconfidence, complacency, laziness, arrogant pride. So these 4 emotions are, though it feels positive, feels pleasurable, but these are too pleasurable. These emotions will still block our path to progress. So we have to learn to understand intolerable negative and too pleasurable emotions, and we have to learn to bring ourselves to kind of tolerable emotions. Which are these tolerable emotions? Irritation, sadness, concern, regret, or pleasurable positive emotions like confidence, love, affection, satisfaction, empathy, serenity. Now, why should we do this? You will ask me this next question. Why should we learn to do this? Why should we learn to regulate our emotions? Next slide, please. Next. So why we should learn to handle our emotions? We have you guys are in 3rd year. So last year in pharmacology, Dr. Thorat madam or Dr. Gavkar madam must have taught you about autonomic nervous system, sympathetic and parasympathetic supply. So let me just refresh your memory about this. You know what happens when there is sympathetic overactivity or there is a parasympathetic overactivity. When we are angry, when we are our heart rate increases, our blood pressure increases, our body becomes very taut. When we are depressed, when we are crying, we feel very sad, we feel very low. Our body also reacts in the same way. So whenever there is an emotion, body reacts in the same manner. When there is a panic attack, anxiety, we feel chest pain, sweating, perspiration, dryness of mouth, the legs, we feel shaky. So anxiety, like the emotion like anxiety, also affects the body. So let me tell you a story from one of my batchmate. I have changed the name of that person, but let's call him Santosh. So in our 2nd year, this Santosh was a very decent guy, good, not very good in studies, but okay, decent guy. Used to very friendly with all of us. In microbiology exam, it was a final exam. I'm not wrong. That day, his journal was not complete. I think it was a prelim exam, so his journal was not complete. And he was still completing whole night. He couldn't sleep whole night, and he didn't study properly. So he was feeling very anxious, very scared of exam. He told all of us that I have not studied well. I am feeling very scared. We all tried to counsel him. We all tried to tell him, "अरे कुछ नहीं होता, tension मत ले, आजा exam को, कुछ नहीं होता." So at 8 o'clock, we all went to micro lab and we started our practical. After half an hour, our examiner started calling name of Santosh. So we looked around. Santosh was not there. So everybody started for searching for Santosh, but Santosh was not in the lab, not in the college campus. One of my friend, one of our peon mama went to our hostel also to search for Santosh, but Santosh was not in the hostel also. So everybody got very scared. After our practical finished, we searched Santosh whole day, but we couldn't find him. And in 2005, we didn't have mobiles to call Santosh, so we were very scared. But in the night, very late night, Santosh came back to the hostel. We all asked him, where was he? So he told us that he was so scared to face the exam that he wanted to end his life. So he went to apna ghat, Krishna Koina Sangam. He went there. He sat for some time. He wanted to end his life, but he couldn't get that courage also. So he came back, and then he went to Bhairavnath to watch movies. So whole day he finished or 3 or 4 movies in that whole day, and then he came back. So Santosh couldn't regulate his emotions. Santosh couldn't handle his anxiety. Because of that, obviously he failed in the exam. And because of that failure, when we passed in 2009, he almost passed after 2 or 3 years after that, because every time he used to get that scary for the exams. So why do we need to learn emotion regulation? Because we need to able to handle our emotions when there is a crisis situation. As we are going to become doctors, you have learned this year. You are going to learn social medicine. So in PSM, there are lifestyle diseases: hypertension, diabetes, irritable bowel syndrome, myocardial infarctions. All lifestyle-related diseases have emotional quotient, emotional problems with them. Relationship issues. Nowadays, I see so many couples having breakups and fights. So relationship issues, we need to learn to handle emotional. In psychiatric illnesses, in psychological issues, in suicide prevention, everywhere, to understand emotion and to be able to handle emotions is very, very important task. So we have reached to a place where we have understood. Next slide, please. We have reached to a place where we have understood some part. This is very long topic, but I'm trying to fit in with a very limited time. So we have understood few emotions. We have understood that there are some emotions which are kind of intolerable to us, which we have understood. There are emotions though which are pleasurable but still not good for us. So we have understood it. So let's have little small practical right now. So I'm going to give you homework for 2 minutes. You can type in your chat box, or you can type in your mobile, and you can send it to me later. So everybody listens to song. All of you listens to the songs: Bollywood song, Hollywood songs, any songs, Marathi, Hindi, English, Punjabi, anything. So the activity is, you will send me you will write 2 songs of these emotions. So the first emotion is love. So you will write 2 lines of a song which have an emotion of love. Okay. The second emotion is friendship. So दो गाने फ्रेंडशिप के लिए, ये दोस्ती हम नहीं तोड़ेंगे वाले. So 2 गाने for friendship. Then there are 2 songs should be about betrayal. 2 songs about grief, loss of loved ones. Then 2 songs about patriotism, desh bhakti. Then next emotion is anger, and another one is loneliness, tanhai. So I'm giving you 2-3 minutes. I'll just take a break 2 minutes. You can type it. You can type in the chat box also. I want two songs for each emotion. Okay. Okay, so let's resume. किसी ने टाइप किया क्या कुछ? ठीक है, you can still keep on typing, or you can discuss with your friends after the class over. सी आज से ना हम लोग क्या करेंगे, हम लोग कोई भी गाना जब सुनेंगे तब हम विल ट्राई टू आइडेंटिफाई द इमोशन, विल ट्राई टू आइडेंटिफाई what is the emotion, and then we learn that way. It's very easy trick. Okay, अपने iPod पे जब भी आप गाना सुनोगे, try to identify the emotion. Okay, so coming to next slide. So as we have now, how to go for emotional regulation. So I'm going to teach you some techniques to regulate your emotions with the examples. So how to go about it? We can't go normally. What people tell us, what our friends tell us, अरे दुखी मत हो, जरा हंस ले, हाँ, अरे इतना गुस्सा मत हो, शांत हो जा. So normally people try to get us from extremely negative emotion to extremely positive emotion, which is not going to happen. This is the mind doesn't work that way. So how to handle it? So it's simple techniques. From extremely negative or intolerable emotion, we have to learn to bring ourselves to a tolerable or kind of a still negative but tolerable emotion. Any problem? Any issues with connection? Hello? Can you hear me? Hello? Hello? Can you hear me? So from extremely intolerable emotion, we have to learn to go to a tolerable. We should learn ourselves to go to a pleasurable emotion. And till we need to understand that we should not go to a too pleasurable or too positive emotion, let's bring back ourselves to a positive, pleasurable emotion. So how to do that? Okay, so how to change? Now that is very important. Next slide, please. Next slide. Okay. So now this next half is very important. Please pay attention. How to change? I'm going to give you 5 principles or Panchasutri. This any of these principles you can use all the principles, or you can either one of the principles, but practice it regularly. That is the key. Okay. So next slide. The first principle is defining goals and priorities. मैं आपको एक एग्जांपल बताना चाहता हूँ. Just listen to me, and I'll explain this first principle. For example, अपने कृष्णा मेडिकल कॉलेज के बाहर से आया हूँ, and my bus leaves from Sangam Hotel. Okay, it's a night bus, 9 o'clock bus, and it leaves from Sangam Hotel. And I go to this अपना कृष्णा का door, and I ask rickshaw wala that can you drop me to the Sangam Hotel, please? But this rickshaw wala is kind of arrogant. He doesn't want to go at night time to Sangam Hotel, so he refuses. नहीं आप रिक्शा खाली नहीं, मुझे नहीं जाना है. So now what happens is my mind goes to a very very negative or intolerable emotion of anger. So I become very angry. ऐसे कैसे नहीं बोलते हो, ऐसे कैसे नहीं जाना है, अरे हम लोग हमेशा यहाँ से जाते हैं, हमेशा आपका रिक्शा लेके जाते हैं, आपको आज कैसे नहीं जाना है. So I get very angry. The rickshaw wala is in his own mood. He starts fighting with me. So the fighting starts. I have that emotion that I have to punish him. I have to उसकी इज्जत उसको सबक सिखाना ही है मुझे. So I take him, that rickshaw wala, to police station. I lodge a complaint against him that he misbehaved with me, and even police also takes him to the custody. With all this matter, 2-3 hours pass, and I miss my bus. Okay, so though auto rickshaw wala misbehaved with me, as my goal was not clear. What was my goal? My goal was to reach Sangam Hotel. My goal was to reach to take a bus and to reach Pune. But just because I became so angry, I became so irritated that I forgot my goal, I forgot my priorities, and then I missed my bus. So whenever we are in crisis situation, whenever we are in trouble, please stop for 1 second, ask yourself, what is my goal and what are my priorities? Once you ask this question to yourself, the next point will come in your mind, or next point should come in your mind that what are the factors within my control and what are the factors beyond my control. In the same example of rickshaw wala, what are the factors within my control? अगर मुझे वहां पे पहुंचना था, तो I could have taken other rickshaw. I could have called my friend to drop me. Even if it was so urgent, I could have walked myself because आधे घंटे में तो पहुंच जाता संगम तक. But मैंने क्या किया? What are the factors beyond my control? That I can't change all rickshaw walas. I can't change whole world. I can't change the emotions of everybody around me. So when I try to change people around me, that becomes factor beyond control. People don't change, their emotion doesn't change, and that makes me angrier, and more frustrated. So if I'm in a crisis situation, I need to ask myself, what is my goal and what are my priorities? And I will focus only on factors within my own control. I will not focus on the factors which are beyond my control. And second question about my goal, that I will ask, what is my immediate goal, what is my intermediate goal, and what is my long-term goal? So I will focus only on that. So this is our first principle: define goals and priorities. Now let's go to a second principle. We are going to revisit all the principles after we finish it. Next slide, please. Thank you. So the second principle is thinking about consequences. And what are the consequences, and thinking about in a realistic way. मैं as we are all doctors, मैं आपको एक simple example बताता हूँ. Normally कैसे होता है ICU में जो आप you will work in ICU after a few years, so you will understand this. ICU में क्या होता है, कोई फॉर एग्जांपल कोई हार्ट अटैक का पेशेंट एडमिट है, कोई CVA का पेशेंट एडमिट है, या कोई कोविड का पेशेंट कोई भी एडमिट है. पीपल गो और पीपल कॉल देम, और लोग क्या बोलते हैं कि तुझे हार्ट अटैक आ गया, लास्ट वीक ऐसे ही मेरे अंकल को आ गया, वो एक ही दिन में चल बसे. So we try to terribilize it. Yeah, even we have that habit of exaggerating everything. Even if there is examiner, हमारे टाइम पे ऐसे होता था कि एक्सटर्नल आता था. अभी आई डोंट नो अभी कैसे होता है, बट दूसरे कॉलेज से या दूसरे यूनिवर्सिटी से एक्सटर्नल आते थे, मोस्टली कर्नाटका से आते थे. तो एक्सटर्नल आने से पहले ही उसके बारे में लोग बताना चालू कर दिया, अरे बहुत खड़ूस आदमी है, एंड इतनी वाट लगाता है. एनाटॉमी में तो सारा एम्ब्रियोलॉजी पूछता है, बाकी कुछ पूछता ही नहीं है. सो टेरिबलाइजिंग कि उसके सामने जाने से पहले ही हमारी वाट लग जाती है. So unrealistic. So in first year anatomy, I say मेरे सामने हुआ, everybody was telling me that this examiner is so खड़ूस and वो बहुत गंदे सवाल पूछेगा, आधी बैच को तो वो फेल करके ही जाएगा. तो there was one senior from our college, तो मैंने ऐसा बताया कि ऐसा एग्जामिनर आने वाला है. सीनियर ने मुझे सिंपल वर्ड्स में बोला, भाई तू एवरेज स्टूडेंट है, अगर तुझे फेल करना है तो उसको ना आधी बैच को फेल करना पड़ेगा, और कोई एग्जामिनर आधी बैच को फेल करने के लिए नहीं आता है, नंबर 1. और तेरे लिए तेरा पहला एग्जाम है. एग्जामिनर्स तो सालों से एग्जाम लेते आए, उनको क्या पड़ी है, वो आएंगे 5 मिनट सवाल पूछेंगे, खाना खा के खाएंगे, निकल जाएंगे. सो I was so calm after that. Just my mind was so anxious that I was thinking all the bad consequences. When I came back to a realistic one, my emotion changed. My mind became very calm, and I could generate alternative. The next point is generating alternative. When you are in a crisis situation, try to find out what are the alternatives you have. Okay, अगर मुझे I'll give you another example. 2-3 years अभी just half an hour back we are trying to connect with a WebEx meeting, but we couldn't connect. So that was a crisis situation. इतनी सारी प्रिपरेशन की है मेघना मैम ने, सर ने, आप लोग सब आए हो, कुछ लोग ऑफलाइन है, कुछ लोग ऑनलाइन है. So we wanted to have this meeting, but just because few factors were beyond our control, internet speed is beyond our control, so meeting was delayed. So I started thinking in my mind, what are the alternatives? If I want to talk to you, if I want to connect to you, if we want to finish this meeting, what are the alternatives? The simple alternative was to connect from my mobile, just off my videos, and at least I can continue this meeting. So whenever we are in crisis situation, just try to find out alternatives. So this is our second principle. Next slide, please. The third principle is problem versus blame. Uh, I'll give you one more example now. See, एक बार ऐसे हुआ कि एक डॉक्टर की ओपीडी में एक पेशेंट आया. डॉक्टर वाज वेरी सीनियर डॉक्टर, गुड डॉक्टर. तो पेशेंट आया, पेशेंट को लास्ट वीक की ट्रीटमेंट दिया था, एंड पेशेंट ने आते आते डॉक्टर को बोला, डॉक्टर आपके ट्रीटमेंट से कुछ फर्क नहीं पड़ा. गॉट सो एंग्री, अरे ऐसे कैसे फर्क नहीं पड़ा, इतनी अच्छी दवाई मैंने तुमको दी थी, तुमने कुछ गलती की होगी, तुम लोगों को दवाई ठीक से समझती नहीं है, तुम लोग ने टाइम पे नहीं लिया होगा दवाई, या किसी और डॉक्टर के पास जाके तुमने ट्रीटमेंट लिया होगा, ऐसे कैसे मेरी दवाई से फर्क नहीं पड़ा. सो जस्ट पेशेंट सेड ओनली वन सेंटेंस कि डॉक्टर आपकी दवाई से फर्क नहीं पड़ा. डॉक्टर वेंट टू आई कांट स्टैंड इट. दिस इज कॉल्ड acute I can't standarditis. We have all infections, na? Itis is inflammation. So acute I can't standarditis. I can't stand that my patient is commenting about my treatment. I can't stand that somebody is behaving like this with me. I can't stand that my girlfriend left me. I can't stand that I got 5% less marks in my exam. So I can't stand it. And once I say I can't stand it, again I go to a intolerable emotion of anger, depression, anxiety, and guilt. Okay. So what happened in that OPD? That even patient got frustrated. Patient started started abusing doctor, and the fight went on. And then doctor end up doctor उस patient ने doctor ही change कर दिया. So if this kind of situation arises, that somebody is we are facing a situation where we are stuck. So we normally have a tendency to blame someone. So we blame other people, we blame ourselves, we blame God. अरे यार ये, और we blame नसीब. अरे यार मेरा नसीब ही खराब है, ये साल ना सारे एग्जाम पे जो मैंने पढ़ा था उससे बाहर ही सब आया. ये मेरा बैड लक ही खराब है. So we try to blame on something. Guys, if you are stuck somewhere, just change the word, focus to your problem. What is the problem? Problem is I am not getting enough marks. What can I do? Okay. Problem is my patient is not benefited with these medicines. What can I do? Normally this kind of situation arises in the OPD or in wards, that patient says कि नहीं सर फर्क नहीं पड़ रहा है. तो फर्क नहीं पड़ रहा is the problem. तो अगर फर्क नहीं पड़ रहा है तो क्या कर सकते हैं? चलो let's discuss again. Let's see your medicines. Let's revisit your reports. So what is the problem? And once you come to a problem, your emotions will come from I can't stand it to I can stand it. Yes, I can stand it, and I can stand it that there will be people who will not agree with my opinion. And if I say I can stand it, I will come to a tolerable emotions. So third principle is problem versus blame. I will not blame anyone. I will not blame myself, my surroundings, my friends, Naseeb, or God. I will not blame anyone. I will try to find problem about this whole situation. The fourth principle is person versus behavior. So what is this? We normally just take an example that two friends are fighting. मैं मेरा दोस्त एक दूसरे से झगड़ा कर रहे, और मेरे दोस्त ने मुझे कुछ बोल दिया, यार ना तेरे से बात ही नहीं करनी. So we immediately go in a situation that I don't want to talk to with this person, I don't want to be with this person, and this whole person is bullshit, this whole person is crap, and I will ये सब एकदम selfish आदमी है, इसके साथ कुछ बात नहीं करनी है, इसके साथ कुछ संबंध ही नहीं रखने. So whenever there is a argument, there is a disagreement, we normally tend to blame or tend to create a images in our mind that whole person is bad. Instead of that, let's go back to our example of Dr. Reva and her mother. We just had that example. What was that example? That Reva's mother told her that not to go for a trip. रेवा ने क्या किया? रेवा ने मदर को पूरी मदर एकदम ब्लैक एंड व्हाइट कर दी. मदर तुम मेरे से हमेशा ऐसे ही बिहेव करती हो, तुम हमेशा मुझे जाने नहीं देती हो और आज से मुझे तुझे से बात ही नहीं करनी है, तू यू आर नॉट अ गुड मदर. Okay, so if you focus on whole person, the emotions will go again to a intolerable one. Let's bring ourselves from a person focus to a behavior focus. What is behavior focus? That I do not like your this behavior. I do not. I know you are such and such person, or you are my friend, or you are my colleague, but I do not like your this behavior, and I will not tolerate this behavior. Okay. So for example, अगर किसी friend ने हमको cheat किया, तो I will tell that I did not like that you lied to me, but that does not make me you as a bad person. That I just did not like your behavior. So just when we are in a crisis situation or emotionally problematic situation, try to think like that ki I will only focus on the problem behavior and not as a person. And the last principle, the fifth principle, that is labeling versus emotional regulation. We always say labeling is labeling is a disabling. When normally we have a habit of labeling someone. हम किसी को भी जब पहली बार मिलते हैं, we start thinking in our mind, अरे बहुत ऊंचा है, बहुत छोटा है, काला है, गोरा है, मोटा है या मोटी है, इसके बाल देखो कैसे है, या इसकी स्पीच देखो कैसी है. So we always try to label someone. Even we label our teachers, we label our friends, we label our relatives, we label governments, we label atmosphere. So we normally label, and once you label something, once you attach a negative label to someone, we will think like that. एक बार हमने बोल दिया एग्जामिनर खड़ूस है, तो उस एग्जामिनर से आने वाला सारे क्वेश्चन हमको टफ लगने लगेंगे. एक बार हमने बोल दिया कि यार ये बहुत कंजूस है, तो उसके बारे वो जब भी कुछ भी बोलेगा हमको लगेगा ये कंजूसी है. So once you start labeling someone, your emotions go below intolerable emotions. Okay. In psychiatry, we have cases called personality disorder. So even here also we label, अरे ये तो पीड़ी है, इससे इसका कुछ नहीं होने वाला, हाँ ये हमेशा ऐसे ही करने वाला. So once you label, your emotions will go in a negative way. I will not label someone. I will try to regulate my emotions whenever possible. Okay. So these are 5 principles. I'll enumerate again. The first principle was I will always try to focus on goals and priorities. I will think of next slide, please. Next slide, please. I will think of consequences and I will try to generate alternatives. I will focus on problem, not blame. I will not blame anyone. I will focus on the behavior, the wrong behavior, the unwanted behavior, but I will not focus on the person, and I will try not to label anyone or try not to label myself. कभी कभी हम खुद को लेबल करते हैं, यार मेरे से मैं एकदम आलसी इंसान हूँ, मेरे से कुछ नहीं होने वाला. So once you label yourself आलसी, then you will not work. So don't label yourself. So I will not label anyone and will try to regulate my emotions. And how I am going to regulate my emotions? Using all these 5 principles. Okay. So these are 5 principles. I understand that this must be very tough new words for you, little difficult for you, but you can click photo of this slide, or I'll share my presentation with Dr. Meghna. She can give it to you. If you only try these 5 things whenever you are in crisis situation, whenever you are facing viva, when there is a breakup or there is emotional issues, anything, try to bring these 5 principles in your mind. It will help you. Okay. Next slide, please. So next slide. Thank you. So what we have learned is, we have learned that there are intolerable emotions, there are tolerable emotions, but still it can be negative emotions. There are pleasurable positive emotions, and there are two pleasurable that are harmful but pleasurable, two pleasurable emotions. Sometimes we need these negative emotions also. Sometimes we need anger. If teacher doesn't scold in the class, students will not sit in the class. So sometimes we need negative emotions also, but it has to be as a strategy. if negative emotions becomes your pattern of life, pattern of behavior, like I told the story of my batchmate Santosh, उसके बारे में सारे negative emotions ही उसका anxiety was his pattern of behavior, so he couldn't succeed in his life. So if negative emotions become a pattern of your behavior, we have to change. On how we have to change that, we can use those 5 principles, okay, to change our emotions. Next slide please. Okay, so there are pleasurable emotions, as we talked about. What are the pleasurable emotions? Confidence, love, affection, satisfaction, trust, curiosity, empathy, and serenity. So I need to practice to bring myself to these pleasurable emotions regularly. This is not going to be a one-day task. What will happen that as our mind is rehearsing, hello, any issues?
2 मिनट यहाँ पे लाइट गया है, याद है, इलेक्ट्रिसिटी गया है 2 मिनट. हेलो.
Okay.
Yeah. 2 minutes. You can start.
हॅलो ओंकार सर.
चालू करू परत.
हा करा.
So I guess every technical things are going to test our patience today. No? So this is practical going on for ourselves. Just we light गई थी, so I just remember one incident. I'll tell you how we applied all these 5 principles. Okay. We were doing a program 2-3 years back in Shirdi. It was a program for doctors, and we were doing a stress management program for doctors. Dr. Anand Nadkarni sir was here in Shirdi, so it was a big deal for us. So we had booked a big hall, and we had arranged all this projector and sound system and everything. And the program timing was 10 to 12 in the morning. It was Sunday, 10 to 12 in the morning. So we started a program sharp at 10:05, and program was going very good. Sir was explaining very well about emotions and about stress management and how doctors should behave. It was going very well. By 11:15, suddenly power went away. Suddenly the projector stopped working first. That was the first thing happened. So for me, it was because it was very important program for my hospital. So I panicked. But then, as sir was already teaching about these 5 principles, I could see the slide that what are the factors within my control and what are the alternatives. So I remember that I have a second projector in my bag. So I just took out that second projector and we started continuing that program. Okay. After 10 minutes, sound system stopped working. Okay. So again, it was a testing time for us. So as sound system stopped working, we had a portable small speaker and that Ahujaga speaker. So we started our program with that portable sound system. Okay. So we were trying to work on factors within our control. We are trying to generate alternatives what we are having. We are trying to not to go to a negative emotions. We are trying, because there were 150 doctors sitting in the hall. They were all were eager to hear Dr. Nadkarni, and technical difficulties were coming regularly. Okay. So program went till 12:45 at 11:45. So last 10 minutes of program are remaining, and we could manage till then. Suddenly जो हॉल हमने बुक किया था वो एक्चुअली एक शादी का हॉल था, मैरिज हॉल. तो सडनली अ मैरिज पार्टी केम एंड दे स्टार्टेड प्लेइंग देयर म्यूजिक, बैंजो, तौबा तेरा जलवा वगैरह सब चालू हो गया सडनली. इट वाज सो लाउड दैट दैट मतलब सब हमारी आवाज एक दूसरे के पास जाना बंद ही हो गया. then last 10 minutes of program remaining. उनका हॉल का बुकिंग 12:30 था, but suddenly they came early and they decided कि just let's have fun. तो नीचे ग्राउंड में उनका सब डांस भी चालू हो गया. Now what to do? Now we wanted to finish those 10 minutes. So I became so angry initially. I wanted to go and shout with this hall owner. ऐसे कैसे आप लोग कर सकते हो, हमारा इतना इंपॉर्टेंट प्रोग्राम है, हम ऐसे कैसे आपको डिस्टर्ब कर सकते हो, आपको अकल नहीं है क्या, blah blah blah. But I decided कि this is not the time. I went back and I asked, what is my goal? My goal is to complete this program as good as possible. My goal was not to trouble this hall owner, this marriage hall owner. So I went downstairs. I requested that marriage party to please be quiet for 10 minutes. There is a program going on. Fortunately, they agreed. So within next 10 minutes, we finished our program. We finished our this talk, and then we left hall, and then the marriage ceremony was continued. So this was a situation, which was a very tough situation. But as I told you that we managed to continue this. So today also we are facing so many situations, and hats off to IT guys and all the people present there, that we are trying to continue as good as possible. Okay. Next slide, please. So I'm going to play 2 videos for you. The first video will identify the emotion, and you will classify in your mind whether it's a pleasurable or a tolerable, positive or negative, which is a intolerable or tolerable, positive or negative. You are going to classify. Meghna, can you please play video? Can you please play video?
Yes, sir.
व्हिडिओ झाला, प्ले करून की मला सांगा. Video from movie 3 Idiots.
So, it's a joy. So, actually, that and also my parents actually was a salary rental for application. In that case, after a back of food. Hello, Dad. Relative साहब बात करेंगे. इस बार आपका बेटा ग्रेजुएट है. ये 5 years all the great life. Unrealistic project ऐसा नहीं बता. It's making a lot of helicopter. Very different. क्या आप train की reservation बन? I'm so sorry. So this close to the project ready. Is the project ready? अभी तो देख तो नीचे से. थोड़ा सा एक्सटेंशन देख. इसको की बात में 2 मिनट कंसंट्रेट नहीं कर पाया सर. 2 मिनट खाना पीना छोड़. ना छोड़. stand very close up with the big to reaches up. Inspector Lobo, Sunday afternoon को यहाँ पे बैठे हैं. Monday morning to be with Father William, easy calling. Well, I think what he did, I was thinking about it.
So आपने सारा ये वीडियो देखा?
दुसरं लावायचं आहे का? दुसरं लावायचं आहे.
नाही नाही दुसरा नाही लावायचा, थांबा पहिला आय एक्सप्लेन द फर्स्ट व्हिडिओ.
तर एक मिनिट.
So you guys saw the first video. What was the emotion? What is the emotion of Joy Lobo? क्या होता है उसके बाद? ये तो आपको याद होगा कि actually he goes for very negative emotions and emotions. So he is faced with the crisis situation, faced with the blockade in his life. Once you go a choice of emotion, depression, you tend not to think, you tend to go to a very terminal crisis of taking suicide. So this is the situation normally we face. उसमें एक अच्छी लाइन है, डेडलाइन. हम लोग ना हर प्रॉब्लम को ना डेडलाइन मान के चलते हैं. कभी भी प्रॉब्लम आता है अब सब खत्म. Once you say सब खत्म, तो mind goes to a negative. Okay, so let's move to the next video. Sir, next video. Before you see this video, I just want to tell something. इसमें हमारे सारे के सारे आए हैं जो 5 प्रिंसिपल ये है ना, मोस्ट ऑफ द प्रिंसिपल जो हमने सीखे इस वीडियो में है. प्लीज वीडियो लिसन केयरफुली.
सामने लोग मिले हैं मैं उससे थर्ड फ्लोर से कूद गया. हुआ क्योंकि मुझे रस्सी के कर दिया गया. क्यों? मैंने नशे में थिएटर के दरवाजे पे पेशाब किया. आपके मार्क्स कंसिस्टेंटली कोई खास वजह? नर्स बचपन से ब्राइट स्टूडेंट था. माँ बाप को लगा कि बड़ी गरीबी मिटाएगा. मैंने मेरा यार तो देखा रेसिंग भी है, फर्स्ट नहीं होंगे तो निशानी होंगी. राउंड लगेगा. Here is not good for grades. और हम क्या करने लगा? पूजा करने लगा. पूजा का भगवान से ठीक माना. ये देखो 16 घंटे ड्यूटी तो मैंने सोचा मौका मिला तब बात सुन रहे. सर आज मैंने भगवान से नहीं कहा कि मुझे एक जॉब दिलाना. मैंने सिर्फ आज के लिए और इस लाइफ के लिए थैंक यू. अगर आप लोग रिजेक्ट भी करते हैं तो कोई अफसोस नहीं, क्योंकि मैं अपनी लाइफ के साथ कुछ ना कुछ धंधा तो कर ही दूंगा. क्योंकि आपका इतना फ्रैंक बिहेवियर तो मैं इसको हैंडल करने के लिए कोई डिप्लोमेटिक आदमी की जरूरत है. आप कुछ स्ट्रेटफॉरवर्ड. बट अगर आपने भरोसा दिला है कि आप अपने इस एटीट्यूड को कंट्रोल कर सकते हैं तो कुछ हो सकता है. तो के बाद अपने पैर पे खड़ा हो सीखा है. लेकिन मुश्किल से आएगा एटीट्यूड नहीं होगा. आप अपनी नौकरी रख लीजिए. मैं अपना एटीट्यूड रख लेता हूँ. सॉरी लोगों 25 साल से मैं रिक्रूटमेंट कर रहा हूँ. बहुत सारी इंटरव्यूज में जॉब पाने के लिए लोग हमारे नाम है हम दिखाइए तो कहाँ से आए हुए हैं. जी सैलरी कितना लोगे भैया इसको कर लेना
देखा आपने? तो 16 हड्डियां टूटी, 2 महीने सोचने का मौका मिला, तब आया एटीट्यूड। अगर आप आज मुझे नौकरी नहीं भी देते हो ना सर, तो मैं अपने लाइफ के साथ कुछ ना कुछ ढंग का कर ही लूंगा। एंड शुरुआत में है, आपके मार्क कंसिस्टेंटली लो है, क्यों? सर, fear is not good for grades. देखिए, whenever he was in a negative that depression or anxiety or guilt वाले इमोशन में था, तब he was not performing. एक बार he changed himself to a better emotion to perform well. And now as it's so good that he's saying कि बड़ी मुश्किल से आए एटीट्यूड, अब नहीं होगा सर. So very good. So he has applied most of the principle to change himself. So next slide, please. So today we have learned principles of emotion regulation. These are 5 principles. The first criteria for any emotional regulation is I have to take responsibility of all my emotions. Once when I accept all are mine, then only I can start the process of emotional regulation. मैं मेरी इमोशन के लिए किसी और को जिम्मेदार नहीं ठहरा सकता. I have to take responsibility of my emotions. I need to train myself to experience and name it. इतने सालों में हमने इमोशंस सिर्फ एक्सपीरियंस किया, उसको नेम नहीं किया है. So try to do that exercise of songs and emotions. I need to train myself. I need to train myself from coming from intolerable to tolerable and tolerable to pleasurable. I will use 5 pairs as guidelines, both positive and negative. One more important point, all experientially positive emotions are necessary helpful. Pride, arrogant pride, positive emotion, it's not helpful. Laziness, so it's experientially positive, not helpful. Overconfidence, complacency, not helpful. So experientially positive emotion. All experientially negative emotions are not harmful. Okay, and concern is not harmful. Regret is not harmful. You work over that. You try to do something else when you regret something. So all experientially negative emotions are not harmful. Okay, so I hope you have understood whatever I have tried to talk to you. I think the time is also short, so I thank you all of you that next slide please. I thank all of you that you listened very patiently. I know it's very difficult to listen to someone when there is it's not offline. Online, it's quite difficult to keep your attention. Thank you for your patience. Thank you, Kim Skarad, my teachers, my seniors, to inviting me. It was pleasure for me to come. It was very emotional for me. Thank you so much. God bless you. Over to you, sir.
And yeah, I thank Dr. Omkar for having accepted, and I thank you people for having tolerated with discipline. I'm very glad that students maintain decorum today. I'm very happy about it. Of course, vote of thanks hona hi chahiye. So after thanking Dr. Omkar for having accepted and done through with this pretty well, I really liked. I tried to listen to his talk outside. It was really good. I hope you learned something from this. I hope you now have a few tools in your own toolkit on how to manage your own emotions, no matter what they are. Okay. And of course, convener, student guidance cell, Dr. Karambekar sir, for having suggested Omkar's name. He's my junior, my colleague and sir student. And I would like to thank the institute, Dr. Suresh Baba Bhosle, for his always positive attitude towards anything that the university and its staff do for the students. And all the members of Student Guidance Cell who have joined us online, their students, I would like to thank all of you for your time. Please ensure that feedback forms are filled by 11 o'clock. Otherwise, I will not be able to generate any attendance. And I thank the IT department, photography department, the powerhouse people who came here on time and reduced my own anxiety. Thank you very much. Right.
I disconnect.
Hello, Omkar. Hello.
I'll talk to him.